one of the things I'd like to, with your permission, to explore is something that is often goes hand in hand with post-traumatic stress disorder. And that is alcohol consumption. Sometimes people who struggle with exposure to trauma, they are more likely to drink heavily than those who don't have PTSD. Now, that's not true for everybody, and it may not be true for you. So I'm not suggesting that there is a problem, but I would be not serving you if we didn't, with your permission, to explore that. I'd like to just ask a couple questions and see where we are with that.
Sure.
Is it okay? Mm-hmm. Okay, thank you. And when we talk about drinking, I'll be asking questions like how many drinks and so forth. And just so we're clear on what we're talking about here, I'd like to show you what I'm going to ask you questions about. How many drinks? It's going to be a standard drink. A standard drink could either be like 12 ounces of beer, 4.5 ounces of wine, or 1.5 ounces of liquor. So when I ask how many drinks on a typical day, you give me an answer based on using this as a metric, a measurement, unit of measurement. Okay, all right. Now let's do this here so you can look at it if you need to. Well, let's just start. I'll show you this instrument that I'm going to ask, and you can even see the questions that I'm going to be asking you, Roger. It's called the Audit or Alcohol Use Disorders Identification Test. And this is an instrument that's used, it's a standardized instrument, it's widely used, just to figure out, to get a sense of a person's drinking pattern and to see to what extent that their level of and pattern of drinking puts them at risk for alcohol-related problems. So, and there are no right or wrong answers, just to be honest with me, just as you were with describing some of your military experiences. And and I'll just tell it like it is, and I will dutifully record it down here.
Sure.
And so I'll just ask these questions, and then when we're done, I'll just score them out, and then we'll just compare that with some normative data, how that stacks up against national averages and so forth.
Yeah.
All right. Well, we'll start it here, and I'll show you as we go along here. Roger, on how often do you have a drink containing alcohol?
Every day.
Every day? Okay. All right. How many drinks containing alcohol do you have on a typical day when you're drinking?
Oh, 3 or 4 maybe.
3 or 4? Okay. All right. How often do you have 6 or more drinks on one occasion?
Just on the weekends.
On the weekends, so that would be 2 nights, 3 nights, or
2 maybe
2?
3.
And sometimes 3, but okay.
Mostly 2. Yeah.
Okay, so that would be, alrighty, so weekly, that would be 3. Okay. Number 4, how often during the last year have you found that you were not able to stop drinking once you had started?
I could stop anytime.
Okay, so that's never then?
That's never.
Okay,
Yeah.
all right. How often during the last year have you failed to do what was normally expected from you because of your drinking? Like whether or not showing up for work or not doing your best or...
Yeah, probably less than a month or less than once a month.
Okay, so less than monthly?
Yeah.
Okay. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session?
I don't think I ever feel like I need one. I may have one, you know.
Okay. Okay.
To get started. You know.
Okay. So how often have you needed one? You would say never, but how often have I done that? Whether I needed it or not, what would you say?
That's pretty occasional too.
Okay.
Yeah.
So here are the options here, like never, less than monthly, weekly?
Less than monthly.
Less than monthly?
Yeah.
Okay, all right. Again, I don't want to pressure to give you an answer that I'm looking for, just whatever it's like. Okay. Number 7, how often during the last year have you had a feeling of guilt or remorse after drinking?
Yeah, I don't feel guilty from drinking, but I feel, I guess, remorse or dread if I know it's going to cause trouble when my wife get mad.
Gotcha.
Yeah.
Judy.
Yeah.
Okay. So about how often does that happen, where you have a feeling of regret or remorse for drinking?
Probably once a month.
Once a month? Okay. How often during the last year, Roger, have you been unable to remember what happened the night before because you've been drinking?
Less than monthly.
Less than monthly? Okay, that'd be one. Two more. Have you or someone else been injured as a result of your drinking?
I have.
Oh, you have? Okay. And how did you injure yourself?
I fell.
Fell. And was that in the last year?
Yes.
Okay, all right. So that would be you. And last question. Has a relative, friend, physician, or another health worker been concerned about your drinking or suggested that you cut down?
Yeah. My wife
Your wife?
and a doctor.
Your wife and a physician. Okay. So wife, Judy, and also a physician. Okay. And was that in the last year?
Yes.
Okay, all right. So what now I'm going to do is I'm just going to tally up your scores here and come up with a total score. And then I'm going to compare this total score with some normative data, and I'll explain what I mean by that. So,
Okay.
4, 5, 20. Or 20 or 21 if we counted this. You don't feel like you have to drink, but you sometimes do. So
Right.
you'd either have a score of 20 or 21 if you wanted to count that one up there. So let's just look at this. Let's look at the 20 now. Compare your score of 20 with this instrument here. This questionnaire has been given to thousands and thousands of people in nationwide, and then they compare their scores with the extent to which they experience alcohol-related problems, whether it's physical problems, legal problems, marital problems, problems on the job site, those kinds of things. So comparing your score of 20, where that puts you compared to that group, that distribution, it puts you in the high category here. And the way it reads here, it says further diagnostic evaluation for alcohol dependence. And another way of saying this too, this score means that people who score in this range, 20 or more, which would be you, are people that are in the high risk category for having problems, either health or marital problems, legal problems related to drinking. Not saying that this is your case or not, but just that's how you compare. And we'll revisit that in a moment. But I'd like to shift gears to just looking at another set of things. You know, everybody who drinks alcohol, you know, they have their own reasons for doing so. That makes them feel good, or they just like the taste, or whatever. So what I'd like to do is just start off by asking, what are some of the benefits that you the good things that you like about alcohol? What are some of the good things, Roger?
Well, I do think it helps me to sleep.
Helps you sleep? Okay.
I like the taste.
Like the taste? Okay.
It helps you not hurt inside.
Imagine the things that hurt inside of your times in the military.
Yeah. Well, in life.
And life in general.
Yeah.
Okay. What are some of the other benefits, Roger?
I think it's a social thing, you know. It kind of lightens the whole atmosphere for everybody, you know.
Alrighty. Lightens the whole atmosphere. Okay. Well, and there may be others, but let's just look at it now, I'm not suggesting that you should consider the prospect of cutting down drinking, but if you were, what do you see might be sort of the downside of cutting down your drinking from its current levels?
I think I would have a harder time sleeping.
Okay, that's it. Okay, that makes sense. Harder time sleeping.
I don't. I think that it would be hard. I don't know if it's downside, but it seems like when you're hanging out with your friends and everybody's drinking, I don't know. It seems like it's a drawback or something to that.
Okay, so if drinking helps you sort of enjoy the the levity of the social life and all your friends are drinking, the idea of you not drinking would sort of put the kibosh on that?
Yeah.
Okay, so no fun in social situations, is that pretty well captured?
Yeah,
okay.
that's good. Plus, I think the cost. I actually think I'm more uptight especially in my free time, if I don't have something to drink.
Okay, so if you didn't have a couple of drinks, you find yourself just being more uptight. Okay. Anything else that comes to mind?
Starting to draw a blank.
Okay, all right, that's fine. Now, with everything, there's the pros and cons. You talked about the benefits of drinking. What are some of the costs of drinking? Some of the costs that you're drinking has
Well,
caused?
it is a cost to the relationship, I suppose, of my marriage.
Okay, so problems with your relationship with Judy.
Mm.
Okay. Marriage. Problems with my marriage with Judy. Okay. And what are some other costs that come as a result of drinking?
It definitely costs a good bit of money.
Oh, the money. Okay. And about how much money would you say it costs you weekly?
More than $100.
More than $100. Okay. Oop. 100. Okay.
Other costs. That's something I haven't put a lot of mind to.
Yeah. Oh, yeah. And it's not as though people think that. That's the reason why. That's what we do in therapy.
Yeah.
We spend some time to talk about these things if you don't think about it otherwise.
I think it's something of a stigma. Because everything that happens, everything says, well, it's because he drank.
Can you give an example in your case? What made you mention that? For example, or for instance.
Well, if you don't go to work or come in late.
Okay. So it sounds like you identified two causes. One is that drinking causes problems on the job, and then there is the stigma that comes along with problems on the job because of drinking. People start looking at you through that eye.
And the stigma might be beyond the job in a sense because, some people just don't like drinking. They see you as a drinker if you have.
Okay. So just overall stigma. You're one of them, a problem drinker. Yeah. Okay. Well, now let's just look at this final category here. What do you see are some of the benefits of, if you were to cut down drinking, what do you see would be some of the payoffs for you, Roger?
Hopefully I could get along, maybe not quite as much trouble with Judy.
Okay. And by maybe not as much problems with Judy, but maybe a restored relationship with her. Is that?
Hopefully,
Okay.
yeah.
That would be your
Goal.
Your goal, your desire. So restored relationship, marriage with Judy. Okay. What are some other benefits that you would get if you were to cut down on your drinking?
See, since I don't really see my drinking as a problem, I don't really know what to say.
Mm-hmm. Mm-hmm. So you find some of the cause of drinking are problems with your marriage with Judy, it costs you money, the stigma, but the benefits of cutting down drinking would be as
Okay, I suppose it was saving money. Looking back.
Oh, okay. All right. Okay. And again, I'm not trying to put words in your mouth.
I can go off of that list. Yeah.
Okay. But so save money. Okay.
I don't know. I suppose as far as stigma goes, they'd find something else to worry about.
Yeah. If it's not one thing, it's another. So, okay. But you find that if you were to cut down drinking, it's interesting. When I ask about the cause of drinking, the first thing that came to mind right off the bat was the problems with your wife Judy. And when I ask you what would be the payoff, the first thing you said out of your mouth was, "I'd be able to restore my relationship with my wife Judy."
Yeah.
Yeah. Okay. Well, thank you for taking time to go through this here. And the reason why I'm asking this, just to understand why the heck I'm asking this question, is that if you were to put like a fulcrum underneath this this is sort of like a decisional balance. There are reasons on this side for why you do drink. That's why you sort of tend to go in this direction. But at the same time, you recognize that there are some reasons or benefits of quitting drinking and some costs that come up with drinking that sort of tends to pull you in this direction. That's why that's happened with a lot of things in life. You know, things aren't just that simple. You know, we get tugged and pulled in two different directions. And you helped us both maybe get a clearer understanding of these very things here. So we're getting some really good information, you know, and this is our very first session here, so we're getting a lay of the land here. So what I'm going to do is just ask one final question here as we start our way of winding down our first session here. Previously, I'd ask you, if you were to imagine cutting down drinking, not quitting altogether, but let's say cutting down drinking where you drink 2, and at most, maybe on some occasions, just 3, and call it quits there. And again, I'm not saying that that's what you should do, but if you were to entertain that as a trying it on for size to see how that might work, how ready would you be able to be at this point to try to make that change, where 0 is not at all ready to cut down my drinking, and 10 is I'm absolutely committed to making that change? Where would you rate your readiness to cut down drinking now, today?
I don't really see my drinking as a problem myself.
Mm-hmm. Mm-hmm. Yeah, and this is not a measure of to what extent you feel that this drinking is a problem, but just the question about how ready you might be to cut down, whether drinking is a problem or not, from your point of view. How ready would you be to cut down?
Well, if it was on my own, I'd say 0.
Mm-hmm.
I'll say 1.
Okay. And why did you notice that 1 is pretty low, obviously. You're not anywhere close to really rolling up your sleeves to committing to it, cutting down. But you said if it was on your own, it would be absolute 0. But I noticed that you give it a 1. Why did you give it a 1 and not a 0?
Just because my wife thinks it is a problem, and...
Okay. So the reason why you wrote it as a 1 instead of a 0 is because of Judy?
Mm-hmm.
Okay. Alrighty. Well, we're sort of winding down the home stretch here with our time. We covered a whole lot today, Roger. And I take note of the fact that despite how difficult it is and the fact that you don't want to be here, you showed up. And that tells me that your wife means a lot to you. Mm-hmm. And I honor you for that too. So what I want to do is make sure that if you're willing to continue meeting with me to explore this further and see what are ways that I might be a servant to you and helping you maybe make some important decisions that you're in control of, how does that sound to you?
Okay.
Well, good. Well, what we can do then is we'll set up a meeting for next week. Does that sound okay with you?
Sure.
Good. And then on your way out, we'll stop by Jane, the receptionist, and she'll help you schedule another appointment at your convenience, and then we'll continue this hard work that you worked hard to get started.
Okay.
Okay. Thank you very much, Roger. I really mean it. It's a pleasure meeting with you.